Good afternoon, everyone, and thank you for joining me today for our webinar on planning for retirement. We have a great presentation for you today that will give you some tips and tricks and some of the things that you need to think about when planning for retirement. It's a topic that is coming up more and more often these days, and we're happy to provide you with the information that you guys need and obviously the assistance moving forward in planning and processing and everything as it relates to retirement. So let's go ahead and get started. So for those of you that are new, and I do see many of you today, Cirrus as a whole was founded back in 1994, headquartered in Toronto. We have two main components to our company. One is office lease negotiations, which will come up when thinking about retirement, so it's very important to think about that and know that you have someone that can help you, guide you through the process of planning with retirement and as it relates to your lease. And the Cirrus Healthcare Consulting Division, which I'm part of, we provide billing support and operational consulting for our physicians, both on the group and individual levels. And this is where we come in to help with our physicians when they start thinking about retirement and what needs to happen. So the purpose of today's program is to get you thinking about whether you're going to retire in 1, 2, 3, 5 years and what you need to know about it. There's a lot of components that go into retirement, from planning and process and everything like that. So we want to make sure that you're aware of what needs to be done and let you know that we are here to help every step of the way. So retirement and transition planning. What are my first steps? So first of all, are you going to retire full-time or part-time? Some physicians say, oh, I've been practicing for so many years, I can't just stop cold turkey, and I need to really plan it out and sort of do a gradual retirement. So are you going to be full-time, part-time? What are you going to do? Choosing a retirement date, very important. You need to know at what point you want to retire. Now, it's not set in stone. You know, there's obviously changes that can be made. You can change your mind. But it's good to have at least a rough idea of when to retire, whether it's 6 months, a year, 18 months, 2 years, whatever the timeline is. Try and pick a date and try and stay as close to that as possible. You must inform your staff. Do any of them have formal employment contracts? No employment contracts, so giving them sufficient notice. In most cases, you've had your staff for so many years, it's almost like family. You want to give them as much notice as possible. And if there's a new physician taking over for you, give the staff the option to stay if they want to, or if that's what you've discussed with the incoming physician. Are you in a group practice? What's your governance agreement say? So in most governance agreements that we've seen lately, there's requirements for notice. There's requirements for notice with regards to the ministry, but you also need to let your group know. Again, whether it's 2, 3, 6, 12 months, whatever the case is, you need to let your group know. And what are the requirements according to the governance agreement on replacing you? If you're planning to replace yourself and you're planning to sell your practice, does the group have to vote? Does the group have any bearing on who you bring in? In most cases, yes. So it's very important to know that, and we can help you go through the governance agreement to know what to look for and make sure that you're following all the rules that you need to. If you have cost-sharing responsibilities, again, are you on the lease? What other requirements are you signed in as? Do you have any cost-sharing agreements? Do you have any, contracts with vendors that your name is part of that you want to sort of remove your name from so you don't have any liability moving forward? Hopefully you don't have any personal commitment to the landlord either. If you do have a lease in place, hopefully it's within your corporation or through your business and not through your personal name and personal guarantee. Are you selling your patient roster to your group members? Does the group want to take over all your patients, or do they have the capacity to do so, or are they going to help find someone in and help you bring in an associate to wind down your practice? In a solo practice, not as much to think about, or sort of different things to think about. You want to obviously advertise. You want to bring in the associate prior to retirement, maybe a couple months before so your patients can get used to it, potentially the staff if they're staying on, and of course the lease agreement as well, making sure that you are able to transfer the lease from yourself or from your corporation to someone else or to their corporation. Medicine professional corporations. You might need to convert it to an ordinary corporation, potentially close it completely. For items like this, it's best to consult a lawyer to determine the proper course of action. And again, is your medical professional corporation attached to your lease? If you're breaking a lease or you're transferring a lease, how do you remove your corporation? Or whatever the legal ramifications might be, you make sure you contact a lawyer to find out exactly what needs to be done. Financial implications, letting your banks know, letting your vendors know that you're going to be leaving, stopping any payments at a certain point is very important because you don't want money being deducted for no reason, especially insurance. You're no longer going to be practicing. You don't need as much insurance anymore. You need different types of insurance. So speaking to the proper insurance broker to have proper coverage, not too much, not too little, very important. Speaking to your financial advisors as well as to what you want to do, how you're planning, how you're taking money out, or how you're going to spend money now from your corporation. All those implications come into play when you're retired because you're no longer earning income. Patient notification. According to the ministry, it's about 6 months. You need to have proper documentation to let them know what you're doing to inform your patients. Most physicians, they phone, they have their staff phone the patients that aren't coming into the office regularly. They send out letters. They put out posters in the office or in the exam rooms, emails if you've been collecting them. There's a whole number of ways. Just giving your patients sufficient notice is the right thing to do, and I would imagine that your foremost thought is going to be patient care and making sure that someone is taking over your patient. So giving them the appropriate amount of time in order to potentially find someone new, get used to the new physician that you're bringing in, all those things. So giving them as much notice as possible is very important. What are you going to do with patient records and your EMR? So according to the college, you have to keep your records for a minimum of 10 years. There are a number of services that provide storage for you. We can recommend a few that we've dealt with in the past. But again, you are required for 10 years if you are just closing up shop. If you are transferring it to another physician, it's now their responsibility. But again, the patient has the opportunity to request a copy if they want to move to another physician. So making sure that someone has a copy of that moving forward is very important. With regards to your EMR, canceling any contracts or transferring your contracts to somebody else if somebody is taking over, and maintaining patient confidentiality. So if you have computers that are being thrown out, you have to have them professionally wiped. Just deleting the files off the system doesn't do anything. They have to be professionally dismantled, if you will, to make sure that information is no longer readable. So you're winding down your practice. Obviously, there's a few ways, as we've discussed, whether it's a new physician coming in or you're just walking away. So if a new physician is coming in, you're going to have to do a roster transfer. You have to assign the lease in most cases, and you're going to have to work with your staff in a transition process. Whether or not they're staying, leaving, whatever the case may be, you have to work with your staff. Now, if you're walking away, a little bit more goes into it. Obviously, giving notice to the appropriate parties, security deposits that you might need to get back, rent reconciliations if there's any that need to happen. Do you have to return the property in a certain form? Did you get the property in a blank slate and you built it out and you did whatever you needed to do to make it workable for you, but now you need to give it back to the landlord so they can rent it to somebody else, whether or not it's a doctor or someone else. Maybe they need it in a certain form. Very important to check your lease for that. Any liabilities that you have with regards to your lease or financial obligations, you must tie up all loose ends. That you don't want to realize 5 years down the road that you forgot to tell someone, or if you forgot to cancel a contract or something like that, and you've been paying for all these years, and then trying to recoup the money is just going to be a big headache. So who requires notification? Medical associations, organizations. These are just to name a few, or at least most of them, obviously from the ministry to the college. It's very important to let everybody know that you're either going to be fully retiring and not practicing medicine anymore, or potentially just leaving family practice. So some of the Cirrus services that we offer as it relates to retirement planning, so roster transfers, roster reconciliations, making sure you know who's on your roster, who's not, making sure that if there is a physician taking over, that they're getting the best possible roster, that the value of your roster is there, that they understand what they're getting, how much they're potentially paying for, excuse me, what they're getting in return. Signing on new physicians, adding the add-on applications to your FO, making sure that the lead physician is aware, making sure that they're signing off, making sure that the incoming physician is signing off, making sure that the ministry is aware by speaking to them. Both the lead physician and the incoming physician will need to call the program analyst in your area, in your LIN, to make sure they're aware of what's happening. Optimize your practice to better attract someone to take over. We work with a lot of physicians in the year, 2 years, sometimes longer, years leading up to retirement to make sure that everything is being billed for appropriately, making sure that you're getting paid for the care you're delivering based on the patient population that you have. This is very important for someone coming in and potentially buying your practice, because they want to know that whatever you're doing optimally, you're doing to the maximum, and if they come in and do the same thing, that they're going to be able to earn and maintain the same amount of income. There is obviously potential for drop-off when patients transfer from one to another. Everyone understands that 5-10% give or take. But overall, the majority is going to stay, and the majority of income is going to be there, assuming your practice is optimized. And that's very important leading up to retirement. Educating your staff, patients, and potential incoming physicians. Again, posters, letters, phone messages, emails, anything and everything that you can possibly do to make the transition as smooth as possible for all parties involved. Group planning for transitions. If you're in a group, if you're in a FO or a FIG, or you're in an office with other people, you have to speak to them. You have to let them know what's going on. Potentially in your governance agreement, it's going to say that they have to vote, or they have the opportunity to deny entry for certain physicians that they don't want to have join the group. So it's very important to have that conversation with your group, giving them as much time as possible, and yourself as much time as possible in the event that they do say no to someone. And practice valuations. What's your practice worth? How much should you be asking if you want to sell your practice? Should you be asking anything for your practice? In our opinion, from the business perspective, yes, there's tremendous value there. You want to make sure that your patients are being taken care of, but at the same time, you worked hard for the last number of years, and you want to make sure that you get something out of it at the end of the day. So some of the key takeaways for today: transitioning your practice into retirement can be difficult and very time-consuming. We are here to help. We will help from A to Z. Every step of the way, we will be there to guide you and assist you and make sure that everything is done that needs to be done, and in a timely manner without having you worry about it. The roster, again, roster reconciliations and your roster itself is the most important part of your practice. That's how you generate the most income, so making sure that everything is optimized as it relates to your roster and is ready for the transition is very important. Reasonable value. Now, this is a tough one because some people are going to say it's worth X, some people are going to say it's worth Y. You're going to have to find someone who's willing to pay what you see the value at. And that's why giving yourself a lot of time and working with us to find that right person is very important. Walking away can be tough, from all aspects. There's a lot that you have to deal with. There's a lot of emotion that goes into it. You've been working for so many years. You've been in the same place for so many years. You may not feel ready to walk away, but we are here to help. We are here to make sure that all the loose ends get tied off, and we're here to make it as quick and easy as possible. So thank you very much for joining us today. That brings us to the end of our presentation. If you do have any questions, please feel free to email. My email and contact number are listed there. We're happy to help you at any point in your transition process, whether or not you're just beginning to think about it, whether you're 2 months out, 1 month out, however long, we're here to help. This presentation was recorded, so if you do have someone else that might be interested in viewing it, or you think it might be of use to them, please let us know. We're happy to send a copy. A copy will be uploaded to our website as well, where we have a number of videos of our webinars that we've done in the past, and you're more than welcome to take a look and see what is there for you. So again, thank you very much for joining us today, and hope you all have a great day, and we'll speak to you soon.